Lecture number 10 here for chapter 19. We're going to talk more about hypertension and hypotension as homeostatic imbalances. All right, so the term hypertension, as I'm sure you already know, has been mentioned more than once, I'm sure, throughout your anatomy and physiology classes. Hyper refers to increase, hypertension refers to high blood pressure. So the definition for that is if a patient has continuously elevated arterial pressure of 140 over 90 or higher, they are considered to have hypertension. Patients can have pre-hypertension if you have elevated levels, but you're not yet in the hypertension range. So if you're around that 140 over 90 mark, but you're not quite to the point where you're over that all of the time, you can be considered to have pre-hypertension. You just have to be careful when about diagnosing these types of things with a patient, because sometimes patients will have temporarily higher blood pressure due to things like fever, like we talked about on the last video lecture, exerting yourself physically, or emotional problems. Emotional problems stimulate the sympathetic nervous system. Sympathetic nervous system increases cardiac output, it increases peripheral resistance, and both of those things increase your blood pressure. And we also talked about how in obese people, and you don't even have to be obese, just being overweight can also increase your blood pressure as well. All right, so having prolonged hypertension is a big time problem in the United States. Lots of Americans have this condition, and over time that higher blood pressure can lead to heart failure. It makes your heart work harder. Remember when we were learning about cardiac output, remember the one of the things that influences your stroke volume is afterload. Remember that. So afterload was what's the pressure in the aorta that the left ventricle is having to compete with to open up the aortic semilunar valve so that blood can be ejected up into the aorta. If you have higher aortic pressure, that afterload is higher, and so the walls of the left ventricle have to contract with more force to get blood up into the aorta and out to your out into your systemic circulation. So if you have longer term hypertension, that means you have higher pressure in the aorta, that's higher afterload, and your heart is going to have to work harder to circulate blood. That can lead to heart failure over time if it's not corrected. All right, vascular disease, as we were talking about earlier as well. If you have atherosclerosis, you have an increase in this fatty plaque buildup inside the walls of arteries that reduces the diameter of the lumen, and remember that increases peripheral resistance. Blood can't flow through the arteries as well. That's going to increase your blood pressure. Increased blood pressure is not good for your kidneys. It can cause kidney damage. You have very delicate tissues in the kidneys that are responsible for filtering the blood and forming urine. We'll study that in more detail at the end of the semester, but higher blood pressure can damage those delicate structures in the kidneys. And renal failure is not a good thing. For one thing, you're not removing impurities from your blood, but also remember that your kidneys are very important for helping you control your blood pressure. So high blood pressure can actually damage your kidneys, which makes it even more difficult for you to control your blood pressure. That's kind of a positive feedback type thing that's not so good. Strokes, higher blood pressure can put you at a higher risk for stroke. You can have blood vessels that burst due to the higher blood pressure, the pressure against the walls. As your blood vessels weaken, especially as you age, they're more likely to burst, which can cut off the blood supply to your brain, and not a good thing. When your heart has to work harder due to prolonged hypertension, it's fighting against that increased pressure in the aorta. The myocardium has to enlarge so that it can contract more forcefully to make that happen. But over time, it's going to weaken and it becomes flabby, and it's just not functioning quite as well as it used to. All right, hypertension can be classified as either primary or secondary. And primary is, secondary hypertension means there's some underlying cause that's leading to the hypertension. Primary hypertension means it's the main problem. You know, there's not something else that's triggering the high blood pressure. High blood pressure is your main problem, which is causing you various types of issues. And this is 90% of patients you will encounter who have elevated blood pressure. It's actually primary or essential hypertension is the name for this. What puts you at risk for this? That's what risk factors are. I've found in the past that some students don't understand the term risk factor, so you should be sure you understand what a risk factor is. A risk factor is something that increases your risk of having a condition. So the things that are listed here, if you have these, this makes it more likely that you're going to have primary hypertension. You're going to have high blood pressure. It's not the other way. Some students think risk factors mean, well, if I have hypertension, then I'm more likely to have those conditions. Okay, so these are the things that might be causing you to have high blood pressure. High blood pressure does not cause the things that you see listed there. All right, so heredity, so certainly our genetics can play a role in whether you're more likely to get high blood pressure. Diet, the diet that you eat, a high sodium diet. Generally the typical American diet, the things that Americans typically like to eat, puts you at a pretty high risk for high blood pressure. Obesity, as we've talked about, age, as we've talked about, diabetes mellitus, puts you at risk for high blood pressure for various reasons. When you have diabetes, you have more fats circulating in your blood because your cells can't use sugars as much for energy. So you have fats flowing through your blood to supply energy that way to your cells, and those fats can accumulate in your blood vessels. That can lead to atherosclerosis. Long-term stress, you guys know, we talked about cortisol back during Unit 1. That can increase your blood pressure. You have increased glucose in your blood, also with diabetes, and due to cortisol being released from stress. Water follows glucose. Increases your blood volume, increases your blood pressure. Smoking, lots of toxins in cigarette smoke that get absorbed into the bloodstream and damage blood vessels. Also, nicotine can trigger vasoconstriction, which increases your blood pressure. All right, controls for blood pressure. There are antihypertensive drugs, and I mentioned one of those before, ACE inhibitors. They inhibit that enzyme that converts angiotensin 1 to angiotensin 2. And if you don't have, angiotensin 2 does a number of things to help you raise your blood pressure. Increasing exercise helps lower your blood pressure, improves your heart efficiency, helps you burn calories so that you're less likely to deposit fats in the walls of your arteries. Losing weight will help you lower your blood pressure as well. Stopping smoking, obviously. Reduce salt and fats and cholesterols that you take in your diet can get deposited in the walls of your arteries as well. Now there's a lot of nutritionists, there's debate back and forth about the types of fats that you need to have in your diet, so try to keep abreast on the latest nutritional information and recommendations about the types of fats that we're supposed to have in our diets for good heart and cardiovascular health. Now salt, there's no question Americans take in way too much salt in our diet than we need to. We all like salt, it tastes good, but and your kidneys are pretty good at making sure your sodium levels don't get too high, but there's only so much your kidneys can do to control sodium levels. And so the more salt you have in your body fluids, the more water will be attracted to that salt, and that's going to increase your blood volume and will increase your blood pressure. So just keep that in mind. All right, secondary hypertension means that something else, there's a major health problem, major disorder, major homeostatic imbalance that is triggering the hypertension. So it could be due to things like renal arteries being obstructed, kidney disease. The kidneys are not able to function properly to help control blood pressure. You could have endocrine disorders that we've learned about before, like hyperthyroidism. Increased thyroid hormone production increases your metabolism. And how's your body going to respond to an increase in metabolism? You're going to increase your blood pressure so that you're circulating oxygen gas and nutrients to these cells in the body that are demanding them because of their increased metabolism. Cushing's syndrome, when you have an overactive adrenal cortex, you have excess aldosterone secretion. Aldosterone triggers more sodium retention in your body fluids. Water follows sodium. That's going to increase your blood pressure. Also, the cortisol triggers increased glucose to be retained in your, an increase in glucose in your blood. Water is also attracted to glucose, so that's also going to increase your blood volume and increase your blood pressure. So when a patient has secondary hypertension, the treatment needs to focus on the main cause, the Cushing's syndrome, the hyperthyroidism, the kidney disease, whatever it is, more so than giving somebody blood pressure drugs. Okay, hypotension is the other way around. Hypo means too low. And so a patient has hypotension if their blood pressure on a typical basis is below 90/60. This is generally not a concern, but if it falls much below that, it could lead to inadequate blood flow to your tissues. So if major organs are not getting an adequate supply of oxygen, gas, and nutrients, they're going to quit functioning, and that's not a good thing. But in general, people with lower blood pressure have a higher chance of living longer and not experiencing cardiovascular illnesses like so many people in our country tend to experience. All right, 3 types of hypotension, some definitions here you should be aware of. Okay, orthostatic hypotension. We talked about this before. This is temporary low blood pressure and dizziness that you experience when you suddenly stand up when you've been sitting or lying down. And that's because your blood pressure drops when you're in those types of positions, because your heart is not fighting against gravity as much to circulate blood up to your brain up here. When you stand up, it takes a few seconds for those baroreceptors to realize, oh, blood pressure has dropped, and the cardiovascular control centers need to jack up the sympathetic activity to increase your heart rate and increase peripheral resistance so your blood pressure will go up. So temporarily your brain is not getting enough oxygen, gas, and nutrients, and the brain is very sensitive to those types of things. Immediately you'll start to feel kind of dizzy and crazy when that happens. So that's normal. That's orthostatic hypotension. So you have to keep that in mind when you're measuring blood pressure in a patient. You don't want to have a patient stand up from a reclined position and immediately measure their blood pressure. Chronic hypotension, long-term hypotension, could be due to things like poor nutrition. You could be dehydrated. That's another reason for chronic hypotension. I live with a couple of members in my household who, for some reason, never drink anything, so they tend to have lower blood pressure a lot of times, and even doctors tell them about it. Addison's disease, if you remember that disorder, that's when you have an inactive adrenal cortex, and so you don't hang on to as much water in your blood. You tend to pee it out excessively, and you wind up being dehydrated because of that. Hypothyroidism as well, low metabolism, can lead to lower blood pressure. Acute hypotension, this is short-term, severe. Acute tends to mean short-term and severe. This can indicate circulatory shock, and we'll do a separate video lecture on shock, because shock is where blood pressure is so low you may not be circulating blood adequately. There's not adequate blood flow to vital organs. So that's something that has to be monitored very carefully when people are undergoing surgery. You know, if blood vessels get cut open and patients experience blood loss or after an accident, or people in intensive care are maybe having trouble regulating their blood pressure, and so this has to be watched very carefully as well. All right. The next video lecture we have not yet talked about. You know, we've talked about how blood flows. We've talked about how blood flows from arteries to arterioles and into capillary beds, and then from there into venules and out into the veins. And so in the capillaries, one of the jobs of the capillaries is to perfuse tissues. So oxygen gas, nutrients, other good things go out of the blood and into the tissue fluids, and the capillaries need to pick up waste molecules from the tissues. So what actually makes that happen? You know, why are the capillaries sending out the good stuff and taking up the waste? And so that involves perfusion of tissues, and that will be our topic for lecture number 11, to learn more about how that works.